It's said testosterone is the hormone that makes men, well, men. It sculpts the male body, increasing muscle mass and bone strength, and moulds the male mind, fueling libido, risk-taking, and the pursuit of status.
But it's selling the hormone well short to say that's all it does, because it has effects throughout the body.
Its impact begins in utero.
Those 9 months that we're in the womb may actually affect the rest of our lives.
And it affects us all.
Women have more testosterone circulating in their blood at any time than they have estrogen. So testosterone's a really important hormone for women.
But while having too much is often perceived as a social poison, inciting acts of aggression, having not enough is, well, not good enough. Testosterone is just a molecule, and yet it has an enormous impact on us. Just how does it affect our abilities, behaviour and health? Well, we're about to find out. Starting in a hedge maze in southern Victoria. This is adjunct professor Richard Wassersug, an expert on the effects of androgen deprivation therapy, ADT. It's a drug treatment for prostate cancer and stops the production of testosterone to prevent the growth of the cancer.
High levels of testosterone activate the prostate gland, and if there's prostate cancer cells, they can inspire them and stimulate them to grow.
Now, Richard and I are going to enter this maze at opposite ends, and our task is to get to the garden at the centre using just this aerial map as a guide. But research suggests Richard may be at a disadvantage because of his own lack of testosterone. Testosterone is a hormone, a chemical messenger that travels the bloodstream to communicate with the cells throughout the body. In men, 95% is produced in the testes. In women, most testosterone is produced in the ovaries and adrenal glands, but it's only 1/10 of the level that it is in men. So what's testosterone got to do with finding your way through here? Well, my testosterone is within the normal adult range, roughly 10 to 30 nanomoles per litre. But Richard, like more than 20,000 Australians, has had his testosterone production completely turned off because of his treatment for prostate cancer.
Personally, I was intrigued by how different my brain worked when I went off of testosterone. So indeed, I experienced it myself, and it inspired me to look into it deeper as a scientist.
Now, there is some evidence that losing testosterone because of ADT does affect a man's ability in navigational tasks like this.
This is confusing. It's actually problems like working through a maze or finding your car in a parking lot that are the actual cognitive challenges that these men have. I certainly, having been off of testosterone, I find these challenges to be very real. In fact, actually, this is sort of known already because women typically use a slightly different navigational strategy than men. Women pay attention to landmarks, and it appears to be related to testosterone.
On the other hand, men tend to navigate using distances and direction. It's thought this plays into testosterone's visuospatial strengths. In general, men perform better than women at mentally rotating three-dimensional objects or manipulating a map in their mind.
But that doesn't mean they're necessarily better in all areas. And for various ways of getting around, sometimes knowing where things are and exactly where they are is an advantage.
I'm not sure that either strategy is any good in here.
Since I knew that women could use landmarks, I've tried to develop a landmark approach to navigation.
Made it.
And I think as an aside, I think we could be helping patients by letting them know this, because they're afraid they're going to get lost when they don't have testosterone to blindly lead them in the right direction.
Hey Richard, how you going?
Hang in there, I think I'm going to be able to find my way out.
We'll come back to Richard later. Testosterone has also been found to affect the abilities of women as they age.
Lift up your legs, cushion underneath. When a woman hits menopause, estrogen is going along and it goes plonk. It falls precipitously. In complete contrast, the fall we see in testosterone starts in women in their mid-20s. So by the time a woman's in her 40s, her testosterone level is about half as what would have been in her 20s.
In a recent study, Professor Susan Davis tested the mental rotation ability and verbal fluency of postmenopausal women after 26 weeks of testosterone therapy.
She'll rotate them and then decide whether they're a mirror image of the letter.
The study found that after taking the course of testosterone, those areas of the brain activated by the tasks lit up less than beforehand.
What this is really telling us is that testosterone is enabling these women to perform a mental task, but using less brain power to do it.
So their brain was finding it easier.
Their brain was finding easier. What we hypothesise is that when women's testosterone levels fall, they still function normally, but they're functioning below par for them. And that's why women often say, my memory's gone, I'm not as sharp as I used to be, but they're still performing their job.
Testosterone's role in shaping our abilities begins in the womb. In the first weeks of life, the human fetus has neither testes nor ovaries. It simply has gonads, which if left alone will develop into ovaries. So, the Y chromosome in males triggers the development of testes, and with them, testosterone, to masculinise both the male's brain and body. Increasingly, researchers are studying the effects of this early flood of testosterone.
There is so much evidence now that adult health and disease is driven by what happens in utero. And we're thinking more and more that testosterone has a big influence on how our brain develops.
What's that? Yeah, you know what that one is. What's this?
Professor Whitehouse's research is focused on child development, including language delay.
We've done a number of studies. The first one, what we did is we looked at testosterone collected from umbilical cord blood. Now, it's a really cool technique where we actually take the cord blood from birth and then analyse that for how high the levels of testosterone are. What we found is that those kids who have the highest levels of testosterone, they're actually at an increased risk for language delay early in life.
Does that language delay correct itself, or is that a long-term effect?
What we do know is that language is quite unstable during the early years. You can be quite delayed and catch up very quickly, or you can be advanced and then slow down quite a lot.
What comes after 4? 5.
What we found is that this testosterone is linked to quite severe language delay that actually does last into early adulthood.
In a unique study, Andrew and his team explored testosterone's role in shaping the architecture of the brain and looked for a potential link with language delay.
What we then wanted to find out is, well, what's the mechanism? Is it to do with the notion that language centres are on one side of the brain or both?
About 90% of people have their language centres specialised to the left side of their brain.
Why? We think testosterone may affect a part of the brain called the corpus callosum, which is the part of the brain that transfers messages from one hemisphere to the other.
To test the theory, they re-examined the umbilical cord blood of all the children who had recorded high levels of testosterone 20 years ago. This time using the more precise method of mass spectrometry. The brains of those children, who are now adults, were then tested using this.
So we'll start off by putting on the cap on your head.
Right.
A functional transcranial Doppler ultrasound.
When we find it, we're looking out for a whooshing sound.
And that's the actual blood whooshing that you're hearing.
Exactly.
This is an ingenious device. There are 2 ultrasound generators, here and here, and they're measuring the speed of the blood flow through the main arteries that feed my brain. When a part of the brain is activated, more blood flows to that region. So a language test reveals which side of the brain a person's language centre is on.
This is a word generation task. You'll see a letter appear on the screen. I want you to think of as many words as you can that begin with that letter. And then you'll hear a tone, and I want you to say the words.
Okay.
Okay?
Android, alternative, ape,
What we found is that those children or those adults who are exposed to high levels of testosterone in utero, they were far more likely to have a pronounced pattern of lateralization. That means that the lateralization was far more on the left side than anywhere else. And we actually think that that relates to testosterone compromising this flow of information from one side of the brain to the other in utero.
Testosterone also has the potential to affect our behaviour.
How are you?
Oh, Graham.
You made it.
Yes.
As Richard found when he became testosterone deprived.
I feel fairly lucky. I mean, a lot of patients get depressed on these drugs, and of course they get depressed perhaps because there's problems with memory that can happen in some of the patients. I've certainly found that it's affected my sort of interaction with women.
Really?
Testosterone drives male libido, and I found I was less drawn by an attractive woman's body as it went by. But I also found that faces were very much more interesting, and I could appreciate what people's expressions were, and women are far more attentive to facial expressions.
Now, Richard's hardly alone. Studies tracking eye movement have shown that while men are fast to fixate on breasts, the hip-to-waist ratio, and the faces of women, women are likely to focus more quickly on faces. Women also have more empathy, another quality related to testosterone levels.
In general, men with higher levels of testosterone are lower in empathy. They're less attendant fathers. And also, if you experimentally give people testosterone versus a placebo, then they're often impaired at recognizing emotional displays in people's faces.
Perhaps this helps explain why having high testosterone isn't good for your relationship. One study of over 4,000 men found that those with greater testosterone were less likely to get married. And if they did get married, they were more likely to have affairs, to be psychologically remote from their wives, and get divorced. The top 2% in the study were also twice as likely to be physically abusive towards their wives than the bottom 2%. It's popular to link aggression with testosterone, but the hormone is better understood as one of dominance.
Dominance is trying to achieve a higher place in the hierarchy, more power, more status, more respect. In animals, there's a very strong relationship between testosterone and aggression because that's how animals show dominance. They attack, they bite, they boss others around. In humans, we're a bit more complicated. So often you can exert dominance by forming coalitions and working in cooperative groups and acting pro-socially.
In fact, a meta-analysis of the relevant studies found almost no correlation between testosterone and aggression. Researchers suspect another hormone, cortisol, may help explain why. Cortisol is the stress hormone that motivates submissive or avoidance behaviour, such as trying to run away.
Those two hormones interact. So if you have high levels of testosterone, but you also have high levels of cortisol, it's possible that the cortisol could block the effects of the testosterone. But if you have low levels of cortisol, then testosterone can sort of exert its effects. And there were a couple of studies that were done with violent offenders, and they found that there was a relationship there between testosterone and violence and the severity of their crimes, but only for people who were low in cortisols.
Professor Denson wanted to know if this modulating effect of cortisol was reflected in brain activity. So he devised a devious MRI study. It analysed people's ability to control anger under the guise of an anagram test.
So what we'll need you to do is actually use all of the letters that you'll see in front of you to make a word.
We create a situation where the participant is really motivated to control their anger. So we have a very sweet research assistant who pulls the participant aside and says, hey, look.
Dr. Denson's in a bit of a grumpy mood today. He's been getting upset with participants for not speaking loud and fast enough during the anagram task. We really need to make sure that you keep your cool during the task, otherwise the data will be completely worthless.
Yeah, sure.
The deception continued inside the MRI. First, Tom issued a few polite warnings.
Okay, we still can't hear you very well, so please speak up for me, thanks.
Then he gave them a good telling off.
Can't you follow instructions? I essentially say, look, you're screwing up my experiment. Can't you follow directions? And essentially make them feel like a child and just treat them very rudely.
For 2 minutes, the MRI analysed the regions of the brain that regulate emotion and control behavioural responses to impulses.
So what we see here is that these people that are high in testosterone and low in cortisol are actually showing inefficient functioning in this neural circuitry of anger control. So they do want to control their anger and aggression. They're just not very good at it.
Just as we inherit an attribute like eye colour, we also inherit a level of testosterone that does fluctuate in the short term. It's higher when you wake up than before you sleep. It goes up when you win and down when you lose, whether you're a player or a spectator. It falls when men marry or become fathers and increases when they divorce. But over a lifetime, the level spikes in adolescence, peaks in early adulthood and appears to fall with age. And losing it can affect a lot more than just your libido.
I think people often misunderstand testosterone as a sex hormone. That's all it does, is about sex. It's actually a hormone for good health in the male across life.
If you look at men who are being treated for prostate cancer and they get the production of testosterone switched off with a medication that stops it from being produced, that's not good for you.
Typically, guys on androgen deprivation therapy lose about 3 to 4% of their muscle mass, which makes them weaker, but they gain about 10% of their body weight as fat, which makes it even more difficult. So they're gaining weight but losing muscle, so there's fatigue. There's also increased risk of weaker bones, osteoporosis.
Their bones become very thin very quickly. They'll lose as much bone in a year as perhaps a lady would across the menopause. So that tells you what testosterone does, even in your 50s and 60s, to maintain your bone strength.
They get metabolic abnormalities and they get accelerated progression to diabetes and a higher risk of cardiovascular disease.
But any ageing man with low testosterone risks a similar suite of health problems, although to a different degree.
Testosterone levels fall from middle age onwards by about 1 or 2% per year. And many of us believe that the great majority of that decline relates to getting other conditions as you get older, particularly chronic diseases like obesity or diabetes.
So if you lose a lot of weight, testosterone will go up a lot. If you just lose a little bit of weight from just a small change in your lifestyle, it will go up a little. But of course, any little bit seems to help.
This link lies at the heart of a major study led by Professor Gary Whithurd.
Look how much you've lost.
Amazing, isn't it?
He and his colleagues hope to recruit 1,500 men in 5 centres around the country.
So you've hit your 50s and your six-pack is now a keg. You're not sleeping well and you need a whiz in the night. And you can't find your mojo when you need it most. Well, you might have low testosterone.
Chris Beiruther was one of those who responded to the call.
Everybody's when they're getting a little bit older wants to find their mojo, don't they?
The study is called T4DM, and the aim is to see if testosterone supplementation, combined with a lifestyle program of healthy eating and exercise, can prevent pre-diabetes from becoming diabetes, or, in new cases of diabetes, even overcome the condition.
I was diagnosed by my doctor as I was pre-diabetic, and then I saw this online and decided to investigate it and joined up, basically, to find out a little bit more about myself and how I could hopefully arrest that blood sugar level.
We know that when men get overweight and pre-diabetic, their testosterone level falls, but we also know that that low testosterone level in those men predicts the subsequent development of diabetes, irrespective of how it got low. So the question then is, well, if that's the case, what's better? Do you try and get people to lose weight, which is extremely hard to do, particularly men who might have, as a consequence of having a lower testosterone, which is loss of motivation? So maybe the solution is to give these guys testosterone, combine it with a lifestyle program, and test whether testosterone makes them more likely to comply with a lifestyle program.
There you go. 10 more seconds and then we've got another set.
Salad, sir.
All the men are given free access to Weight Watchers
Green salad, 6 points.
and encouraged to exercise and eat well.
What did Bear used to eat?
Ribs, steaks.
Every 3 months, they're given an injection of either testosterone or a placebo.
What do you reckon? You think you're on the placebo or the real thing?
I just don't know.
I've lost 30 kilos in the last 14, 15 months, and I feel absolutely fantastic. Everything that was wrong with me is virtually better.
I feel energetic. I can do more things than I was doing before, and losing the weight actually gives you a lot more self-esteem as well.
It'll take up to 5 years before the results of the study are known.
Go for it, once again.
Now, if low testosterone is bad for you, why doesn't every ageing man just take a little more, or a lot?
We don't know about its safety in older men who are not truly androgen deficient. There's a lot of promises made with not much evidence, and I think if you don't have the evidence, you need to go get it, and that's, I'm afraid, the hard work of doing clinical research.
If you're an older man, you get the best survival with the testosterone in the middle of the range. So what you want is an optimal testosterone, basically in the middle 50%, and you get the best survival with that.
The notion that you should give testosterone back as the elixir of youth and vitality, I think, is still open to some question. And I know of no data to support the practice of doing that, particularly when the alternative, which is losing weight and getting fit, increases testosterone beautifully and is absolutely proven to improve function, well-being and longevity.
Health is a big thing. I mean, if you don't take care of your body, where are you going to live?